Hello everyone. Today we are going to discuss about the topic that is neonatal sepsis, or we can call it neonatal infection. Okay. So we know that newborn means, or neonate means, the baby whose age is 28 days. The newborn infant is uniquely susceptible to the acquired infection, whether bacterial or viral or fungal. Means the newborn are more susceptible to get the infection. So it may be a bacterial infection, or it may be viral infection, or it may be fungal infection. The bacterial sepsis and the meningitis continue to be major cause of morbidity and mortality in the newborn. So because of bacteria, okay, because of bacterial infection or because of meningitis, that is inflammation of the brain, it is a major cause of newborn disease or newborn death in the this age. Okay. The next one is definition. The neonatal sepsis is a disease of neonates who are younger than 1 month, that is 28 days, in which they are clinically ill and have a positive blood culture for infection. Next one is risk factors. Okay, risk factor one is, first one is maternal risk factor likes premature rupture of membrane. Neonatal risk factor likes prematurity, less immunologic ability to the resistance infection, more liable to the penetrate their defensive barrier. So because of maternal cause also baby can get infection, or because of neonatal cause also baby can get infection. Next one is clinical features, that is signs and symptoms of neonatal sepsis. The first one is decreased activity, means the activity level of the newborn will decrease. Excessive crying, the baby will cry excessively. Apnea, jaundice, hypothermia, bulging or full fontanelle. We know that there are two fontanelle in the baby. Okay, fontanelle means the closing point of suture. One is anterior, one is posterior. So in this case, the fontanelle will be bulging. Okay, and the seizures, that is convulsion or hypotonia. The next one is diagnostic evaluation. To find out the infection, what are the diagnostic criteria we have to follow? The first one is, as you know, history collection and physical examination is common diagnostic evaluation for all the disease condition. The next one is blood culture. To find out which bacteria or which virus is responsible for the infection, that is blood culture. Then urine examination, CSF study, that is cerebrospinal fluid study, as there is a chance of bacterial meningitis. Then CBC, complete blood count, C reactive protein, and ESR may be elevated, that is like more than 15 mm in the first hour. So these are the diagnostic evaluation will roll out to find out the infection or cause of infection. The next one is management or treatment. For the babies with the neonatal sepsis, there are two types of management. One is supportive care, one is antibiotic therapy. So like directly we will not start with antibiotic, we will first go for the supportive care. If the supportive care is not improving the baby's condition, then we will go for antibiotic therapy. In the supportive care, first one is provide warmth. Okay, because in the intrauterine life and extrauterine life is fully different, so it will be difficult for the baby to adjust in the new environment. So first we will provide the warmth. Start IV line. Infuse the normal saline, that is 10 ml per kg over 5 to 10 minutes. Infuse 10% of glucose, that is 2 ml per kg. Start to manage hypoglycemia. Administer injection vitamin K 1 mg IM to prevent the bleeding. If the baby is cyanosed or grunting, provide oxygen via hood or mask. Normally for the newborn we will use hood or mask. Next one is antibiotic therapy. The antibiotic therapy should cover common causative bacteria like E. coli, Staphylococcus aureus, or the Klebsiella pneumoniae. And the combination of ampicillin and gentamicin is recommended for the treatment of sepsis and the pneumonia. So antibiotic also will plan based on the which bacteria is affected. Okay. Next is prevention of neonatal infection or neonatal sepsis. The first one is demonstrates the effect of hand washing upon the prevention of nosocomial infection. Nosocomial infection means hospital acquired infection, means baby was not having infection before, but from the hospital, from the other patient, because of unhygienic method the baby got infection. The next one is standard precautions should be applied in the nursery for the infection prevention. Means like washing hands, wearing gloves, mask, goggles. Okay, that all the standard precautions should be applied in the nursery to prevent the infection, because the baby are more susceptible to get the infection. Their immunity power is low compared to adult. Thus, installation of antibiotics into newborn eyes 1 to 2 hours after the birth is done to prevent the infection. Skin care should be done using warm water and may use mild soap for the removal of blood or meconium, or avoid the removal of vernix caseosa. We have seen in the normal newborn there is some white color patches in the baby's body which is called as vernix caseosa. It will help the baby to maintain the temperature. Okay, it will cover the whole body. It will gradually disappear, so try to not to remove that. Next one is cord care should be given regularly using the alcohol or an antimicrobial agent. So with this we have completed the neonatal infection. Thank you everyone.